Oh, hey, Nicole Kramer here with Nicole Kramer Insurance Services. I do want to thank you for joining us today. We're going to talk about Medicare Cost Plans 101, just a brief explanation and overview. This is part of our Medicare educational series, and I've designed these to be short and condensed presentations so that you can easily understand them. But if you need to learn more, you can always reach out to us or click and subscribe and watch our other videos. Without any further explanation, let's go ahead and talk about Medicare cost plans. Probably one of the first things that we need to do is simply break down your Medicare options and benefits so that you kind of get an understanding of the different options. On the screen before you, there's really two paths that you can go. The very first path is option one on the left-hand side. In option one, you can enroll in Medicare Part A and B, which is your original Medicare benefits. Then you pick up a Part D plan for prescription drug coverage. And then to complement your A and B of Medicare, you can enroll in a Medicare supplement policy. That's one option, traditional path, original Medicare and a supplement in Part D. Option two is what we refer to as a Medicare Advantage program. Medicare Advantage program, while it's regulated by CMS, the Centers for Medicare and Medicaid Services, it is administered and handled through private insurance companies. And it wraps up your A, your B, and your D all into one plan. They don't all cover drugs, but most of them do have a drug benefit embedded in the plan. But it's all handled through a private insurance company. So that's the two main differences, or two different paths that you can go down. What's the third option? The third option is the Medicare cost plan. Now, Medicare cost plans are only available in certain parts of the country and in select counties. They're referred to as cost plans because the cost of care is split between a private insurance carrier and Medicare. Cost plans are only available in counties with fewer than 2 qualifying Medicare Advantage plans, which is really why you don't see them widely available in large markets, because there's quite a few Medicare Advantage options. Cost plans have some of the same rules as a Medicare Advantage plan or Part C. However, each type of plan has special rules and exceptions, so it's important to contact the plan that you're interested in for specific details. All right, let's break down the three options, including who pays primary and who pays secondary. Let's go back to that first option one. When you have original Medicare with a Medicare supplement, the provider files claims directly to original Medicare as primary. Then the Medicare supplement would be secondary, and they're going to pay all or part of the remaining balance of approved Medicare charges. Option two, the Medicare Advantage plans. With a Medicare Advantage plan, the provider bills claims directly to the Medicare Advantage insurance company with no secondary coverage. So it goes right to the insurance carrier for both A, B, and C and D benefits. With Medicare Cost Plan, it is unique because Medicare Part A claims go directly to Medicare, the same as they do with the Medicare Supplement. And the Medicare Cost Plan carrier pays secondary. With Medicare Part B services, the provider bills the Medicare Cost Plan carrier directly. The way that this is structured, Medicare cost plans allow a customer to have lower out-of-pocket expenses when facing some of their most expensive bills possible, from like an inpatient hospital stay or skilled nursing facility rehabilitation stay. Now, how do Medicare cost plans handle drug coverage? Well, you can join a separate Medicare drug program, or you can get drug coverage from the Medicare cost plan directly if it's offered. Now, you can only add or drop Medicare drug coverage during certain times of the year. If it's not an SEP or your initial enrollment period, it would be during the annual enrollment period. But for Medicare supplement customers who are considering a Medicare cost plan for the first time, that flexibility of the Part D component would allow a Medicare supplement customer to shop and review a Medicare cost option all 12 months of the year. So you can enroll anytime throughout the year if you're already on original Medicare with a supplement. Generally, you can join a Medicare cost plan whenever the plan is accepting new members, even if you only have Part B. You can leave a Medicare cost plan at any time during the year and always return back to original Medicare. There's some top questions that we get out in the market. One is, how does the network work? All right, well, if you're receiving medical services in a county where the Medicare cost plan is sold, you must seek care from the network providers only. Should you happen to see an out-of-network provider in a county that Medicare cost is offered, there will be no benefits from the private insurance company, but you will still be covered by original Medicare without secondary coverage. This is why it's important to sit down, talk to a professional, and walk through the network. Make sure that you check all your providers and that they are in network so you don't run into an out-of-network situation. But in the unlikely event that you go to an out-of-network provider, you still have coverage. However, it's at the standard original Medicare Part B outline. Exactly. So what happens when you travel outside of your state? Keep in mind, if you seek services in any county or state where the Medicare cost plan is not offered, you'll still have in-network benefits and copays, as long as the provider accepts Medicare and agrees to bill the Medicare cost plan. So you still have that coverage if you're going to travel, visit family or relatives, or if you're a snowbird even, you want to make sure you have coverage wherever you're at. And that's based in the United States. Outside the United States, that's a little different. That falls under foreign travel. We can talk about that in another video. So why aren't cost plans in my area? Well, Medicare cost plans are only available in certain parts of the country with a low membership on Medicare Advantage plans. Remember, they can only have 2 Medicare Advantage plans in a market for them to be able to come into that market as a Medicare cost plan. So this means that Medicare cost plans that are available in parts of the country that are in areas where there's a larger enrollment on Medicare supplement plans than in a Medicare Advantage, you have an opportunity to make that change because it's only in select markets where there's very low Medicare Advantage presence. All right, let's talk about cost plan details. Well, private insurance companies offer Medicare cost plans in certain parts of the country. The monthly cost or premium of a Medicare cost plan has nothing to do with one's age or gender. It is the same premium for every customer on that plan. These plans work with both parts of original Medicare A and B, and there is no medical underwriting to apply for a Medicare cost plan. This allows for year-round enrollment of a Medicare cost plan that best fits your need. Additionally, you can travel with a Medicare cost plan nationwide as long as you see providers that accept Medicare and will accept payment from the plan, from the carrier. To be eligible for a cost plan, you must permanently reside in the service area where the cost plan is offered. You still have to maintain your enrollment in Medicare Part B. You either have A and B both, or at least Medicare Part B to be eligible. Some carriers will exclude you if you have end-stage renal disease. There are some exceptions. If you enroll in the plan and then later develop ESRD, you should be able to stay on the plan. But I would strongly encourage you to check with the carrier that you're enrolling with to confirm your eligibility benefits and with them. Medicare cost plans also feature additional ancillary benefits such as dental and vision to cover cleanings, exams, fillings, crowns, etc. Eyewear and hearing benefits that you may not get with your Medicare supplement plan today. Fitness memberships and over-the-counter allowances that will provide benefits for vitamins, Band-Aids, and such. And then some plans will also include nurse advocates or a 24/7 helpline. These are just some of the additional perks that come with a Medicare cost plan. And again, I would encourage you to check with the exact plan benefits of the plan that you're enrolling with. If you have any additional questions, feel free to reach out to us. Don't hesitate to email us, give us a call, or check out our website. I do want to thank you for watching today. If you scan the QR code, you can save our contact information. Be sure to click and subscribe. And that's a wrap. Thank you.